Hi, my name is Lacey Bueller, and I'm going to be doing a presentation over family presence during resuscitation today. And so first off, I want you to understand what family presence is, and I want you to know what it involves. And to do this, I think relation is going to be the best way, because even if you haven't experienced anything like this in your lifetime, you're going to be able to relate it back to something a little bit more simple and a little bit more like everyday life. So what I'm going to relate it to is a parent dropping a child off at daycare. So this parent has two options. They can either stay with the child and they can know that their child is safe, and they can know that appropriate care is being done because they are seeing this care being done. The next is to leave the child. And if they leave the child, they're going to be trusting the experienced and professional health or workers that they're going to be taking care of their child. So with this, with family presence during resuscitation, there's going to be a lot of different emotions. There's going to be a lot of different opinions on this issue. So some members of a family may not feel emotionally prepared to see a loved one in the vulnerable state that resuscitation creates, and would rather trust the healthcare professionals to take care of their family member, while others may feel a responsibility to be present because it brings them a sense of comfort knowing that they were involved in a life-saving process. So family presence during resuscitation efforts has been shown to be beneficial, as well as have negative effects on the family and the patients. So next, I want you to be able to understand what resuscitation is, because to me, to understand the topic of family presence during resuscitation, you need to know what the expected practice is for resuscitation, because healthcare workers are going to have to follow a sequence of steps within a specific time frame in order to have a chance to save this patient's life. So cardiopulmonary resuscitation is an emergency life-saving medical intervention that is used during any effort to revive someone from a previously non-responsive state. So this sequence that the healthcare providers are going to have to follow is first call for help, then look for a pulse. If there's not a pulse, then you're going to move on to chest compressions, and then look for an airway, and then make sure the patient is breathing. If you still do not have a pulse back by then you're going to continue compressions. You're going to get an AED, and you're going to follow the prompts on the AED. So when this has been successful, a patient's pulse is going to return, and it's going to be maintained. And at this point, it's going to be completed. So now that you know what resuscitation is, I want to go over the benefits of family presence during resuscitation. So first off, we'll go over the family. So some family members have reported that inclusion of the family members in care gives them a sense of comfort, knowing that their presence might have facilitated the resuscitation of their family member, and that they have also witnessed that the healthcare professionals have done every single thing in their power to save their loved one. And this gives them a sense of control. So this shows that it decreases the occurrence of complicated grieving, because the family is able to be with those loved one, with those family members in those last moments, and that they know that everything has been done to save this patient. So it honestly, research shows that when families have been at the bedside during resuscitation, and they've reported that they would repeat the same and make the same choice again. So the next one is the acceptance of the loss. So when their patient passes away, and if a family is there, the family is allowed to touch and see the body and say their final goodbye to their loved one, which is allowing for closure. So the figure that you're seeing is depicts the effect of family presence during resuscitation on the family, patient, and the healthcare professionals. So next, we're going to go over the patient and its benefit and their benefits. So there's limited data available on the patient, because only about 18% of patients live through resuscitation. And if they do live, a lot of them don't remember who was there and what was going on. But it does suggest that the patients feel that their relationships with their family have been enhanced, and they feel comforted by their family's presence. So to me, this relates back to the innate nature that children have to be comforted by their parents or other family members when they are fearful or they are in discomfort. So while there's a lot of positive side effects that I've just mentioned, there's also a few negative ones. So next, we'll go over drawbacks. So drawbacks will include family presence at the bedside and how it exposes them to events that could possibly cause psychological trauma. So when the family's at the bedside, they're going to be seeing a lot of emergent and aggressive actions and a lot of aggressive interventions that are being done to save their family member's life. So while it may be comforting to know that the healthcare providers are doing everything possible to save the family member's life, it may be psychologically scarring of seeing that done to a family member. So also, family members who are emotionally unstable during resuscitation process may act as a distraction to healthcare professionals. So during an emergency, all of the focus is going to be on the patient, and anything that changes that focus is going to be detrimental and almost life threatening to a patient. Another downfall that family members being present at bedside that can possibly occur is that during the resuscitation process, the expectations of family members are not going to be the same as what they're seeing. So many people have formed expectations of resuscitation based on TV shows such as like Grey's Anatomy and shows and movies, but this doesn't accurately represent the aggressive and the violent measures that the healthcare providers are having to do to save this patient's life. And these misconceptions of the expectation of care can lead to family members being very angry after, and can also lead to healthcare professionals being having a lawsuit, and it can also lead to the psychological scarring. So this is my resources, and that was family presence during resuscitation.